Hi, and welcome to my channel. My name is Lolix. In today's lesson, we'll be taking a look at Part B of the listening section of an OET sample test. We'll follow the instructions provided by reading the question, then listening to the extract, after which we'll go over the transcript of the extract we listened to and find the answer for each question. Let's get started.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a consultant talking to a woman whose father has just been admitted to hospital. Now read the question.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem?
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Question 25. You hear a consultant talking to a woman whose father has just been admitted to hospital. What does she want to know about his condition? A. How serious it is. B. How much pain it's causing. Or C. How long before there will be a diagnosis? So at the very beginning, we hear the consultant talk about the various things that might have caused the father to collapse. He talks about multiple symptoms that they investigated so as to rule out any life-threatening conditions. So when we hear this, we immediately think of the word diagnosis, but C is not the correct answer here because we haven't heard the woman ask the consultant any questions yet. Next, the woman says it could take some time to get to the bottom of the problem. Once again, we can associate this with the word diagnosis, but since it's not a question, we have to rule out option C. Then the consultant says the patient is quite stable now and that they're encouraged by the progress he's making. To which the woman replies that she's glad to hear it, and then she asks a question, but at least he's not in any great discomfort, is he? To which the consultant replies that the pain is well controlled and they will keep his sedation at an adequate level. So the answer to question number 25 is given there, which is option B, how much pain it's causing.
Question 26. You hear a trainee nurse receiving feedback from her tutor about the ward round she's just completed. Now read the question.
How do you feel your ward round went with that patient? Oh, I really should have told him what I was about to do, rather than just rolling up his sleeve to take his blood pressure.
Yeah, it would have been preferable, but at least you realise.
Thanks.
I think you did your observations really well, though. You checked the patient's details are correct, you put the date in, you timed it correctly, you observed that all your parameters are within normal range, and you did the respiratory rate while you were doing your manual pulse.
Yes, the pulse was quite strong and regular.
And you could have passed that on to reassure the patient too. But you look back at the previous observations, put your signature at the bottom. That's all good.
Thanks, okay.
Question 26. You hear a trainee nurse receiving feedback from her tutor about the ward round she's just completed. What would have improved the nurse's performance? A. Eliciting information from the patient. B. Keeping the patient better informed. Or C. Updating patient notes more fully. In option A, the word eliciting means to get or to find out. The conversation starts with the tutor asking how the trainee nurse felt the ward round went. To which the trainee nurse replies that she should have told the patient what she was going to do rather than just performing the procedure. The tutor then says, yes, it would have been preferable, but now you realize the mistake you made. Then the tutor says that the trainee nurse did her observations really well. She checked the patient's details, put the date, timed it, observed all the parameters, and did the respiratory rate. Lastly, the tutor says that the trainee nurse could have passed on information in order to reassure the patient. So the answer to question number 26 is option B, because it has been pointed out twice in the conversation. The first time where the trainee nurse herself says that she should have told the patient what to do, to which the tutor agrees, and at the end where the tutor says that the trainee nurse could have passed on information to reassure the patient, which is another way of saying to keep the patient better informed.
Question 27. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. Now read the question.
So who's next?
The patient in bed 12, she had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities. Her falls risk is high given her recent history. She's been assessed by the physio, and she's on a rollator frame to ambulate. Her skin integrity is intact, and she's responded well to all treatment.
Good.
She's on a normal diet. The observations were last done at 6 a.m., and they were stable. Her medications are IV Tazocin due at 2 p.m. and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed. At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
Question 27. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. What does he want his colleague to do? A. Encourage greater mobility. B. Organize a visit by a dietitian. Or C. Consult with the medical team. Here, in the given extract, we can hear the nurse tell his colleague about the patient's history as well as her details. And in the details, he does say that the patient has been assessed by physio and that she uses a roller frame to ambulate. While this does talk about the patient's mobility, it doesn't talk about encouraging it, so option A is wrong. Then the nurse goes on to talk about the patient's diet by simply saying that she's on a normal diet. Now this does not indicate about anything about talking to a dietitian, so option B is wrong. Then later in the conversation, the nurse says to his colleague that she needs to check with the doctors if the patient will continue with the IV antibiotics and whether the cannula can be removed. So this indicates that option C, consult with the medical team, is the correct answer to question number 27.
Question 28. You hear two hospital managers talking about a training session for people who do voluntary work with patients. Now read the question.
So how do you think the volunteer training course went?
Well, we had a reasonable turnout, considering that these people already give up their free time to drive patients to appointments, visit inpatients, all sorts of stuff like that. It's quite a lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it, if the feedback sheets are anything to go by. From my point of view, though, I just wasn't sure whether it went into issues like customer care, confidentiality, that kind of thing, in enough depth.
Well, that's something we can always look into before we roll out any more.
Well, I think we should.
Question 28. You hear two hospital managers talking about a training session for people who do voluntary work with patients. What do the managers think about the course? A. Too few people attended to make it worthwhile. B. The content may need revising for future sessions. Or C. The feedback from participants wasn't encouraging. Let's look at the conversation. So the first hospital manager asks how the training course went. To which the second hospital manager says that there was a reasonable turnout considering that these people give up their free time. So this directly invalidates or tells us that option A is wrong, because a reasonable turnout does not mean too few people. It means enough people. So option A is wrong. Then the first hospital manager says that the people who did turn out seem to get something out of it if the feedback sheets are anything to go by, which meant that the people that came for the training session found that it was useful and they gave positive reviews for it in the feedback sheets. So which implies that option C is not the correct answer. Then he continues by saying that he wasn't sure whether it went into issues like customer care, confidentiality, or that sort of thing in enough depth. So this implies, or this tells us, that option B is the correct answer to question number 28.
Question 29. You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Baker. I just wanted a quick word about Mrs. Milton's prescription, the one for anti-inflammatories that you gave her after last week's consultation.
Oh, yes, for her osteoarthritis.
Yes, so she's been on them for a week now, 500 milligrams twice daily. The thing is, she's just been into the pharmacy complaining of a headache ever since she started the medication.
Really? Well, that does happen in some patients, but maybe switching her onto a different anti-inflammatory wouldn't be a bad idea.
OK, I'll look into some options and then run them past you later, shall I?
Fine, thanks.
Question 29. You hear a pharmacist talking to a doctor about a patient's medication. What is the pharmacist doing? A. Reporting side effects. B. Checking the dosage. Or C. Recommending an alternative. The pharmacist goes to the doctor to talk about Mrs. Milton's prescription that the doctor had given last week. Then the pharmacist goes on to say that the patient has been taking the medication for a week now, and then he gives the dosage. So the patient has already been taking the medication. So option B is the wrong answer because the pharmacist is not checking with the doctor whether the dosage of the medication is correct. Then he says that the patient has come to the pharmacy complaining about a headache. Now this tells us that option A could possibly be the right answer, but since the conversation is not complete, we have to keep on listening. Then the doctor says that maybe switching the patient to a different medication wouldn't be a bad idea, to which the pharmacist replies that he will look into some options and then come back to discuss them with the doctor at a later time. So right here he is not recommending an alternative yet, so option C is the wrong answer, and which leaves us with option A as the right answer to question number 29.
Question 30. You hear a surgeon talking to a member of his team as they are finishing a surgical procedure. Now read the question.
Good, there's no more bleeding. The procedure's finished.
Can we just do the sign out? How much contrast did we use?
That was 120 mils of Omnipaque, and we did reach a high dose, so I'll have to fill out a high dose form. I'll do that afterwards. The other thing was that the ultrasound machine was giving us a few problems.
Yeah, I'll have to get the technician on the phone.
Do it now, though, because we'll need it if we're going to get through all our lists today.
Do we need to send this patient up to HDU?
Actually, everything was quite straightforward, so I'd say a regular ward bed is fine.
That is the end of Part B.
Question number 30. You hear a surgeon talking to a member of his team as they are finishing a surgical procedure. The surgeon says their next priority should be A. To complete a routine administrative task, B. To report a faulty piece of equipment, or C. To locate an appropriate bed. The conversation starts with the surgeon saying that the procedure is finished, to which the team member asks, can they just do the sign out? Now this is an administrative task, but it's not the surgeon who says it or asks it, it's the team member. So option A is not the correct answer. Then the surgeon says that the ultrasound machine was giving them a few problems, and the team member says that she will call the technician. But the surgeon replies to do it right now because they need it in order to get through their list today. So this tells us that option B is possibly the right answer. But there's more to the conversation where the team member asks whether if they need to send the patient up to HDU, but the surgeon replies that a regular ward bed is fine. So option C is not the correct answer, which leaves us with only one, which is option B, and option B is the answer to question number 30. That's the end of today's lesson. If you have any questions or doubts, please leave a comment. Thank you.